My name is Dr. Eric Salud, and I am a general dentist. Root canal therapy is extremely important in my practice. Typically, patients that need root canals are usually in a whole lot of pain. And to be able to remove that source of pain for the patient, it's an extremely gratifying feeling, and the patients appreciate it very much too. What a root canal is that every tooth has a nerve, and if that nerve is damaged, it can elicit a sense of pain. It can become infected. And so what a root canal does, it's a procedure where we remove the nerve from the tooth. So the tooth is still going to be there in its place, but we're going to remove the nerve, which is the source of pain from the tooth. And then we put a crown or a cap on top of the tooth to help protect it from breaking. Well, technology has changed the root canal game completely. With the onset of stronger anesthetic, we are able to keep the patient much more comfortable throughout the whole procedure, to the point where you shouldn't feel anything throughout the whole root canal process. And with 3D imaging, we are allowed to see what the tooth actually looks like inside before we actually work on you. So things become much more predictable. And with newer instruments and equipment, we are able to actually work much more efficiently and have the root canal procedure done in much more timely manner. The most common myth I hear is how painful root canals are. In the past, yes, root canals were painful, but with the local anesthetic that we use now, we're able to keep you numb for a very long time and to keep you numb throughout the whole procedure so you do not feel a thing when it comes to root canals. What I tell my patients is a root canal is pretty much like a really long filling appointment. It's You shouldn't feel anything that we do, and afterwards you should have pretty minimal discomfort. Well, what a root canal is, it's a procedure where we're trying to save the actual tooth. So instead of pulling the tooth, we're saving the tooth and keeping it in its place so that it can function properly by removing the nerve from the tooth, which was damaged. So what a root canal does, it keeps the tooth in its place so you can still use it to function, to chew, to speak, and it'll feel like it's always been there your whole life. After a root canal is completed, the nerve of the tooth is gone and the tooth becomes pretty brittle and weak. And so what a crown is, it's a hard shell or covering that goes over the whole tooth to help protect it so that the tooth doesn't break further. Typically, I say a root canal procedure isn't done until the crown is finally placed on the tooth. Root canals have come so far now that recovery is very straightforward. Typically, there's some minor soreness afterwards, but the pain that you initially felt before you had the root canal is all gone, and you're able to function normally the next day. Typically, I tell patients they don't need to take any time off of work, and if they have any sort of soreness, ibuprofen or Tylenol works perfectly fine. We encounter patients in pain on a daily basis, and typically it's a patient that comes in, hasn't slept, and is in so much pain. Anything that touches the tooth sets them off. And so what we're able to do, usually the same day they come in, is do the root canal procedure and take them out of pain. Typically, what happens is once we numb up the patient and start the root canal procedure, a lot of patients end up falling asleep because this is the first time they're not in pain. And the first time they're not in pain and they're able to just relax for a minute. So we encounter this quite on a daily basis. A patient has ongoing pain and sensitivity. Go see, Come see the dentist. Let's set up an appointment where we can evaluate exactly what's going on and determine what the best treatment is to take you out of pain. If that's a root canal, then we will go ahead and do the root canal. If it's something else, we'll go ahead and do that other treatment. But the first thing to do is set up an appointment with your dentist so that we can take an x-ray, evaluate the tooth, and determine what the next treatment should be.